Good afternoon, everybody. I have about 12:32, so we'll go ahead and get started. We have a pretty healthy agenda. Thank you all for attending the June 2022 Justice Resource Advisory Council meeting. Before I call the roll, I'd like to just take some time to recognize that today is June 3rd, is National Gun Violence Awareness Day. And to also acknowledge the horrendous tragedies and mass shootings that have occurred in the last few weeks in our country. On May 14th, the racist attack on a supermarket and community in Buffalo, New York, that left 10 people murdered. And then 10 days later, another mass shooting in Uvalde, Texas, that left among them 19 children and 2 teachers dead. So I actually remember a time when I would say, I can't even imagine this happening. As we also approach the 7-year anniversary on June 17th of the attack on Mother Emanuel Church in South Carolina, and watching the photos come through the news, actually had to turn the news off for a little while, of those murdered in Buffalo, I would actually be lying if I said that I could not imagine it happening in my community, to my family or myself. And so what comes to mind to me now is it keeps happening. Since the goal of the Justice Resource Advisory Council is to enhance community safety, I thought it would be inappropriate to just move into the business of this meeting without acknowledging the collective grief that this violence has thrown our country into again. And then just to remind us all that we're not hopeless. Keep doing this work, this very important work, moving towards community safety. So I'm not sure if anyone else wants to add anything to that, but I just thought it was appropriate to do that before I call the roll. All right. So
DK, I'm
yes,
sorry. I would also acknowledge, and I don't know if I heard you say this, the incident in Tulsa that just happened at the hospital.
Absolutely.
I think that was day ago.
Anybody else want to add anything?
Hi, it's Tiffany. I also want to acknowledge the gun violence that's happening in our community and that continues to happen.
All right. Well, we'll go ahead and get started. I'll call the roll. Jasmine B. Ferrara. Myself, I'm present. Chief Blake. Pat Freeman.
Present.
Sylvia Clement. Danny Cohen. Judge Thornburg. Todd Williams.
Present. Meredith present.
Meredith, yep. Sam Sneed. Tiffany Ahanacho.
Present.
Donna Roos.
Present.
Chief Zach. Dustin Dow. Julia Horrocks.
I'm present.
Suzanne and Rachel have indicated that they would be absent today. Suzanne Avitz and Rachel Nygaard. Deborah Campbell.
Present.
Esther Manheimer.
Present.
Lori Anderson.
Regina Ray filling in as her proxy.
Thank you, Regina. Jay Hackett.
Present.
And Julie Reisdorf.
Present.
All right. We have a quorum. I don't think we have any action, but we have a quorum other than the consent agenda. So we'll move into that now. You should have received our June agenda for today, and hopefully you've had the opportunity to review it. And then our April minutes. Anybody have any questions or recommended edits to the April minutes? All right, seeing none, would anyone like to make a motion for approval of the consent agenda?
Hey, this is Donald. I so move.
I get a second?
Second.
Meredith,
Meredith? All right. All in favor? Any opposed? All right, consent agenda passes. And then we'll move into our justice systems data update, and Dr. Lee Creighton is going to provide that for us today.
Thanks, DK. Good afternoon, everyone. I am going to share my screen, so bear with me for 1 minute. Pull that up. So hopefully you all see a slide that says jail population update. Great. So as DK mentioned, I'm here to provide a brief update on the jail population. Some of you may be aware that the numbers for the jail have been have experienced a jump recently. And so we're going to walk through kind of where we've been, what we've seen, and where we are currently, and happy to answer any questions that folks may have. So just to get us started, I'm going to show a big picture look at the jail population over the last several years. So this is daily population counts for the local jail population. And when I say local jail population, what I mean is people who are in custody because they have some type of pending charge in the Buncombe County local justice system. They are sentenced to serve their time in the local jail, or they're awaiting transport. We have a few other reasons that somebody might be in custody because of some type of business happening in the Buncombe County Courthouse. We are not talking about any contract population, so not talking about federal holdings or statewide misdemeanor confinement or for any other jurisdiction. So this is local jail population numbers. And so you can see that dramatic drop, that is the onset of the pandemic. And immediately following that drop, we saw the numbers remain relatively low for a number of months and started to see a slight uptick at the end of the summer of 2020. And then it leveled off again for about another 10 to 11 months, right around 326. And it stayed that way again for about 10 to 11 months. We saw another uptick begin at the end of the summer of 2021. And we've really seen that population continue to increase since that time period. At the end of the lines on the far right, what you'll see is a more recent uptick in the last 1 to 2 months that we've seen for the local jail population. So just situating ourselves big picture, this is where we've been and this is where we are. I thought it might be helpful to take a look at this from the standpoint of a year-over-year comparison for the same time period. So taking the most recent month that we've completed, the month of May. So looking at the 5 previous Mays, where have we been in terms of average daily population? You can see that May 2022 is the highest average daily population that has been experienced in the jail over the previous 5 years. Again, for the month of May. One of the changes that we saw happen in the beginning stages of the pandemic was that the rates of disparity, racial disparity began to increase. And though our population numbers are returning to pre-pandemic levels, that rate of disparity has actually increased slightly. So we're still in that place where a higher percentage of the population in custody is Black, and it has remained at a higher level than we've seen pre-pandemic. The third column in this table is incarceration rates, just to give you a sense of sort of how many people are experiencing incarceration in the community. So this is a per 100,000 number. For May 2022, that was 210 per 100,000 adults in Buncombe County were represented in that average daily population. And then finally, that last column is your 12-month recidivism rate. And we actually are showing 3 recidivism rates. The first is for a new charge. The number in the parentheses is for a new violent charge as defined by the public safety assessment that Buncombe County Pretrial Services utilizes. and then for a failure to appear only. So that is the only reason that the person came back into custody is because they had an order for arrest for a failure to appear. What you see over time is those new charge recidivism rates for the 12-month period really have remained relatively stable, despite some pretty significant changes and fluctuations in the jail population. What has changed and what did experience a pretty drastic reduction was the recidivism rate for FTA onlys. That obviously is a reflection of the operations of court during the height of the pandemic. But what we are seeing when you look at the May 2021 recidivism rates, that FTA recidivism rate is returning to what we have seen in previous pre-pandemic times. Just talking a little bit about the drivers of the jail population. So the jail population is a function of two factors: how many people are coming in and then how long they are staying. So this is that looking at that first factor, the bookings. So this is a year-over-year look for the months of January and May for the last 5 years. The chart on the left is bookings by process type. And so that top line, that top blue line represents bookings coming into the facility with new charges, new criminal charges. You can see that is a line that continues to be on a downward trend. The line below it are bookings with an order for arrest. And so that is where we're seeing some changes in terms of an increase from what we saw for the last same time last year. So it's really those bookings with orders for arrest coming into the facility that are driving our overall booking numbers to now outpace where we were this time last year. If we take a closer look at bookings with new charges on your right, you can see that the top, that is bookings with new misdemeanor charges. And that is those misdemeanor bookings with misdemeanor charges are really what's driven that overall booking number with new charges down. The felony bookings with felony charges has remained relatively stable, though we are slightly lower this year for the same time last year. So we'll have to see how that pans out over the course of the year. The next slide is looking at the average length of stay. So then the second factor that influences your jail population, looking at a cohort of January and May releases for the last 5 years. It's an overall upward trend, and the anomaly being the pandemic impacts so 2020 is when we saw that. So this is reflecting a lot of the effort of our justice system partners to release as many people as possible, as quickly as possible, as safely as possible. So that's where that dip comes in, but we now have returned to average lengths of stays that are higher than we've seen pre-pandemic. One of the things that I will note is when we think back to what's driving the bookings, is those bookings with orders for arrest. When we look at bookings for average length of stay with bookings with failure to appear, they on average stay in custody 7 days longer than bookings without order for arrest for a failure to appear. So that's a population that's kind of impacting the jail numbers quite significantly right now.
Lee, can you say that again? The bookings as a result of failure to appear outpace bookings?
Yeah.
I mean,
so let me take us back to this slide. So right now, overall bookings, we are starting to outpace where we were same time last year. So we're seeing more, our booking numbers are starting to trend upwards. What's driving that is not bookings with new charges. What's driving that is bookings with orders for arrest. Orders for arrest are going to be issued for a variety of reasons. Failure to appear is one. Probation, pretrial violations are examples of others. But when we look at those failure to appear bookings, so these are bookings that have an order for arrest for a failure to appear, they on average stay 7 days longer than bookings without a failure to appear. Does that help clarify?
yes, it does. And is any backup data anywhere that would name the income level of those the failed to appears?
No, that's going to be data that I'm not aware of how we could access. We could maybe look at the most recent bond amounts on those bookings, but that would not be necessarily an indication of income level specifically, but it could be a proxy to look at how, what was the amount of that bond.
Lee, they may be able to look at indigent status in the
That's
booking data. I'm not sure, but I believe they could.
Yeah, that's another, thanks Pat for that reminder. That might be a possibility as well, to see if there is that status tied to that person.
Pat, are you saying that it might be possible for us to find out which percentage of the failure to appears, or what the indigent status is of those that are failure to appear?
We may be able to see that data. I can get with Lee on that.
Okay.
Yeah, I'll make that as a follow-up note to see if we can explore if that's a possibility.
Thanks so
I
much.
would also add the community engagement team has been working with the public defender's office, and we've got approval to do surveys and contact folks who have had an FT in the past to see what impacts or what led to failing to appear, just to get more information from those that are most impacted perspective.
So I think I'm probably pretty close to time, if not over, so I apologize. But just to sum up, and if there's any other questions, I'm happy to answer. But just to revisit, last month, the jail housed more people per 100,000 than it had for the month of May over the previous 4 years. The rate of racial disparity in the jail has remained higher than pre-pandemic levels, despite population numbers returning to pre-pandemic levels. We've not seen significant shifts at all in our recidivism rates for new charges, and it's been stable over the last 5 years, despite population numbers shifting. We have seen shifts though with the 12-month recidivism rate for failure to appear only, and bookings with FTAs are returning to pre-pandemic levels. Bookings with new charges do remain lower than pre-pandemic levels, and that's driven mostly by the misdemeanor chart bookings. And then average length of stay continues to increase. So bookings are with the FTA, as we spoke about, are staying in custody longer than bookings without. So that's what I had prepared for today. If folks have questions, or Jay, thank you for that question, and we'll certainly follow up and see if we can get to some answers there with FTAs.
Thank you, Lee. Anybody have any additional questions for Lee on this, or anybody want to add any additional context to what Lee has shared here?
I had a question. I'm curious, Lee, with the failure to appears and being low in the pandemic, is it safe to say because a lot more court hearings were being held virtual, and so theoretically people could appear because they weren't having transportation barriers, time barriers, that type of thing?
Well, I was going to say Meredith could probably speak to that better than I can, but so go ahead, Meredith. Thanks.
So during the height of the pandemic, we were handling mostly jail cases, and the folks who were out of custody were not required to come to court. We would give them continuances, so they weren't being issued failures to appear. Now they are again. We're passing out the new court reminder sheets. I've got them out in admin court, and all the courtrooms have that with the QR code so that they can go on and sign up for the court reminder.
Meredith, I'm having problems hearing you, but it may be just me. Can y'all hear Meredith? Okay.
I'll turn up my volume. I don't know my computer. And then we are weekly meeting the jail review team to look at the jail population and try to handle those cases more efficiently and handle those jail cases quicker.
They still didn't hear you, Meredith. So Timmy,
what Meredith basically said is there's a jail review team to look into who's in custody, to present these to the DA's office, the public defender's office, and present it to the courts about seeing who can be released. During the height of the pandemic, FTAs or OFAs orders for failure to appears were not being issued. And now that we're kind of back in endemic, that they're ordering OFAs, and police are, when they're engaging with folks, they're able to serve the warrants and they're getting picked up for FTAs, failure to appears.
I wonder, and I know that there's no quick, short answer for this, but if when people were released during the pandemic for safety reasons, certainly the justice services professionals released them with an eye towards safety. And the community either did or did not experience greater crime during that time period. If the community did not experience more crime, meaning that our streets were less safe, then why could they not observe the same rubric that they used to release people, or look at similar strategies on how to determine who stays and how long? It has seemed that we did something during the pandemic, and we did it with the eye towards safety. And now things are going back to pre-pandemic. But during the pandemic, the streets were not less safe. I'm not talking about in terms of health and the pandemic. I'm talking about in terms of robbery and crime, et cetera. So I just want to make that note that maybe there's some things that we did during the pandemic that we can still do.
We're still on nonviolent cases. Like I review the 3B bond calendar for each day, and those cases that are nonviolent and lower level crimes, I do a lot of times still consent to unsecure those. Ultimately, it's up to the judge whether or not the bond is changed and unsecured.
Thank you.
Thank you, Meredith. You sound a little better there. Thank you. No, I'm not sure what you did. Tiffany?
The other piece that I missed of recapping Meredith is there's a court reminder system, and it's in the courtrooms, and they're actively trying to remind people of their court dates. Then one issue we saw with failure to appear is the court dates kept getting pushed back. And just like many of us, like you forget that you even had this charge, or that you don't know when your court date is, or just apathy to the pandemic and not being able to come back to court for those. And that's what it seems like our driver is the failure to appears that are driving our jail population.
All right. Any other questions about that information? As we mentioned before, we'll try to bring to each meeting data, not just jail population, but other things that this body needs to look at, consider and monitor with regards to our activity as a system. So if nothing else, really quickly, I'd like to reintroduce Julie. Julie is the newest member of our JRAC, and she's appointed by the Board of Commissioners as a community member. We had a really good onboarding conversation this week, and so I know that Julie is really excited to join this council. Julie, would you like to share anything?
I'm very happy to be here. Thank you for recommending me, and I'm excited to learn. I have a lot to learn.
Thank you. And I think Julie is going to be reaching out to some of the partners. She just wants to learn more about your offices as well, so she can have as much base knowledge to be able to engage in these conversations. Thanks, Julie. Welcome. You'll have fun. All right, so I'm going to mute again and turn it over to Victoria Reichert and Kathleen Blackney. Victoria is relatively new. I think I might have shared that she can't say she's new anymore because we've hired at least a few more people since she started, but she's our behavioral health manager, and Kathleen is with our strategy and innovations department, and she's our behavioral health and justice analyst. So I'll turn it over to them. They're going to provide an update on the efforts around the opioid settlement funds. There you go, Kathleen and Victoria.
Great, thank you for having us and the introduction, DK. I'm excited to be around a group of some new faces. My hope is to share with you all some information about current planning process, what feedback we've been gathering, but also to get feedback from you all. What are you seeing, hearing? What are you wondering about? What have we maybe missed? And I also want to open that opportunity if anyone does want to reach out to Kathleen or I, and she'll add our email addresses, to feel free to reach out. We'd be happy to meet with you, talk about, we are in that continued planning process. How do we, plan for the settlement funds moving forward? So it's a great opportunity to get your input and to help shape maybe that process. So please feel free to reach out to us. And I'm sharing the opioid settlement planning and some of our progress that we're making so far. As many of you may be aware, may not, and again, happy to talk more about some background, but there was a national settlement with 3 manufacturers and distributors where the nation got a pocket of money, and then North Carolina was allotted an amount. And with that amount, they were dividing up amounts to each county and municipality. So Buncombe County is looking to receive about $16 million over the next 17-year period. So we're getting a good influx, and I wanted to show a little visual. We're getting a good influx at the beginning of this year, or this fiscal year, and then getting a little bit over 1 million for the next 3 years. But after these first 4 years, we're going to be under 1 million each year. So it's going to be interesting to, how do we plan some of this money, kind of that investment in the beginning, but not maybe kind of one-time investment versus ongoing. And again, that will be our process of planning over the years, and how we want to use it, and being able to also shift and pivot. What's the need today versus tomorrow? And part of that agreement with the state to get money is to follow a memorandum of agreement. And this memorandum of agreement outlines different strategies, ways that we can use this money, and also reporting processes to the state, so we can be very transparent about how this money is used. And to just give a high-level overview of what these different strategies are, we've got collaborative and strategic planning. So it's kind of that process that we're doing now, getting different stakeholders, people in the community, getting input, looking at data, creating visions, all of those types of things the money could be used for. Evidence-based addiction treatment, which is consistent with the American Society of Addiction Medicine, which does include medication-assisted treatment, frequently called MAT. And then we have recovery support services. This could be peer support specialists, care navigators, and a variety of settings to help link people to treatment, support, primary care, or anything else that will help improve their health and well-being. And then recovery housing, so helping those with rent assistance, move-in deposits, utilities, or fund recovery housing programs that provide housing to individuals receiving medication-assisted treatment. And then there's an employment-related services, so job training, job skills, professional attire, transportation to and from these opportunities, or vouchers. So very broad scope, but helping people get back into the workforce. Early intervention, focusing on youth, and looking at early identification and intervention, training for parents and teachers to help identify those needs and get resources. Naloxone distribution, which is to help people who have experienced an overdose to reverse that overdose, allowing that to be distributed wide and far with different programs and groups. Post-overdose response teams, which work with emergency services and provide community paramedics, but also peer support and clinicians to help support someone who has overdosed or had a non-fatal drug overdose to be able to access services. So following up even days after, linking them to resources, providing what they need to get on that road of recovery. Syringe service programs provides harm reduction, so syringes, naloxone, and other harm-reducing supplies, as well as disposal of syringes. And the most important part is connecting clients to prevention, treatment, and other supports for their health and well-being. And then criminal justice diversion programs, so pre-arrest, post-arrest diversion, pre-trial programs, things that connect people to the treatment that they need, those services and supports for their well-being. And then addiction treatment for incarcerated persons, which supports evidence-based addiction treatment, including medication-assisted treatment. And then lastly, reentry programs. So helping connect incarcerated persons to treatment, recovery support, or other services or supports that they need upon release from jail. So that can be supporting any of the programs or getting them linked to those supports. And then this next slide is just kind of giving you all a high view of what we're looking at planning for the settlement fund. So we're currently an ongoing getting community feedback. We've been focusing on those that are in the field, really getting at some initial input thoughts, many of which have lived experience. We're using the Behavioral Health Justice Collaborative, which was an arm from the Justice Advisory Council, to further look into what are current services and supports and gaps. And we're hoping to provide an initial proposal in August of this year to the commissioners for review. At that same time, we're going to be using our Behavioral Health Justice Collaborative and implementing a strategic planning, which will help us further engage our community. What's that process look like? How are we getting their feedback? But also creating that vision and that process on how we decide to use money. So you may notice that there's been a short time frame of getting some initial feedback on how to use, but we're building out a longer kind of process on how do we do this year after year and really planning in the long run. And all of that process kind of includes data collection, evaluating, right, what's working, what's not working, but also in collaborating with the public and state level partners and even regional partners. So looking at some of our surrounding counties and how can we look at using our settlement funds to look at regional interventions. And so one way that we had received some of our community feedback was a public input page, and Kathleen's going to add these two links for those that are not familiar. Buncombe County has a public input page where folks can add information, respond to surveys, and so we have a page right now that's on the BC Opioid Funds link, and this is where we're kind of keeping some information, resources, minutes from the Behavioral Health Justice Collaborative. We will eventually move it to a home page on the Buncombe County government webpage, but this is kind of to get things going. We have completed a survey, which I'm going to look at next, but we do have a place for comments. So if someone lands on that page and they weren't able to participate in that initial survey, they still have a place to add more comments, feedback, and we can always follow up with those that might request to get follow-up. And then this next website is a statewide dashboard, includes a lot of information about the strategies, metrics and data, and where we will be reporting updates to the state. And so getting into what some of that feedback we got, we asked this first question: what are the most important ways for Buncombe County to invest the opioid settlement dollars? And this pie graph demonstrates those items that were selected as priority, so kind of their tops. It's 18% said that expanding access to emergency behavioral treatment beds was a top option. As you can see, these percentages are pretty equal across the board. And it was interesting, one commenter did indicate, you know, it really takes a whole village. All of these programs and services need support. And I think that is demonstrated with these results. However, another way to look at the same data was to look at this ranking, average ranking. So we have, if someone selected expanding access to behavioral treatment beds as the #1 option, and then another person selected it as #3, it was given an average of level 2 in the ranking. So again, we can see emergency behavioral treatment beds is one of those top options, and then pretty equally on recovery housing, support service, reentry support services, medication-assisted treatment, and also looking at how can we streamline and coordinate services better within our community and within the county. And then part of the Behavioral Health Justice Collaborative, as we had started meeting again this year, the Behavioral Health Justice Collaborative was established, worked on some projects. We focused more on the opioid settlement and getting feedback about what are some of those barriers, problem areas. And these were some of our outputs that were developed, as well as some of our conversations. As you can see, again, that greater collaboration, accessible housing, which we know affects everyone, whether you're in the justice or have substance use issues, looking at reentry services, and again, data sharing. How do we know what we're doing and impacting? How is one program affecting another, or how is that data informing how one program might focus on their support within the community, as well as increasing peer support and also reducing criminal detention stemming from mental health and substance use related behaviors, making sure that people are getting that treatment that they need while still holding accountability. So based on that public input page and some of our previous behavioral health justice collaborative meetings, these were some of the topics that were identified as areas of initial focus. So we want to sustain some of our existing programs. There's funding, grants. A lot of Buncombe County really worked hard to get a lot of these programs in place because we knew this was what was important in our community. It just happened to align very well with the MOA, but some of those grants are ending. And so there was consensus among the group that we want to make sure that these programs continue to sustain and make sure that we're fully supporting the work that they're doing. And then also identifying some other strategies that we would want to look at supporting, such as recovery housing support, really increasing that access for people, reducing that financial burden, but also in the long term, looking at how can we support quality recovery housing and also help them create and secure sustainable funding. So that there is a wide variety of options tailoring to different people's needs, and that they're meeting good standards and being able to sustain, as well as data and evaluation. How do we decide if this program worked and what we're going to fund later on, as well as increasing that opportunity for people to get into residential treatment or ongoing treatment, meeting their needs. And some employment-related services, because once you're out in the community, right, you've got to end up being able to make money to be able to sustain and live, and making sure people are set up to be able to do that. So these are some of our initial areas of focus, and I really am at this point leaving it to any questions or discussions, anything that stands out to you all. Would love to hear your feedback.
Hey, Victoria, this is Donald, and one, great seeing you in the new position. I know you're going to do an awesome job, so congratulations on that. Just one thing I would just say is there's new funding coming down from the state, specifically, SOAR 3 funding. Those dollars are being targeted in similar areas that you've identified here. And so, again, just continue to advocate for some cross-organizational conversation. I know we're probably going to be seeing maybe upwards of $1 million for recovery housing, in the region. And the more we can make sure we're not overlapping on some of our project stuff, the more we can get done. So just let us know if there's a way we can compare our notes, because some of that stuff's happening quickly with the state and changes quite frequently. So just let us know as you're making your decisions and your recommendations for the county.
Thank you, Donald.
Victoria, I wanted to mention just the treatment courts that we have going on now, and whether this money could be used to support those programs, maybe get more people in those programs. We have drug treatment court, veterans treatment court, sobriety support and also the quality drug diversion going on.
And I heard most of that, but expanding like that treatment court, getting people through. And it was nice being able to sit in on a sobriety treatment court and really seeing what that work that does and holding people accountable, but also making sure, as we're talking about, that they're getting that treatment that they need. And so I think there's opportunity of like, are we making sure that people who are involved in treatment courts can access some of the treatment options right out in the community, so that they don't have a wait time, so to speak, and what might be available to help people get in that treatment quicker. Great.
Any more comments or questions for Victoria? We gave plenty of time for this one. This is important work that's happening, and hopefully we'll figure out ways to sustain it moving forward. So, any more questions for the team?
I'll just pop in real quick, DK, and add, if anybody's sort of like, I'm curious, but this is sort of a new topic to me, or this isn't necessarily the avenue I've worked in, just to sort of re-up Victoria's point that state settlement website, ncopioidsettlement.org, in addition to outlining the work that we're doing, and I dropped that link in the chat, there's a range of fascinating data dashboards on that website. So you can go to data dashboards and select NC opioid indicators there and select for Buncombe County, and really look at what is happening on the ground in terms of the impact of this issue in our community, as well as dig into, as Victoria mentioned, just a breadth of information about how this settlement came to be, and as well as some of both the options available to us for using these dollars, but also some of the constraints. But in particular, if anybody's curious but new to the idea, I've found those dashboards highly informative. So just to put an extra shine on that, on top of what Victoria.
Thank you. Thank you. Victoria, this is Jay. This presentation was awesome. And just to know that this is happening is so reassuring. When you looked at on the screen that showed the 12 areas, and then you described some of the supports that will go for various programs, I think across the board, lots of the direct service providers, especially the ones that are smaller, have voiced both in community engagement platforms and in community networks the need for administrative support. They've talked about it over and over and over again. And the thing is that when direct program funds go to support direct programs, but don't fund the administration of or the infrastructure for programs, then the whole program suffers. Oftentimes, funding is limited to direct services. I wonder, in just your understanding, your discussion of this, would there be significant or considerable, or is it just up for discussion, the amount of infrastructure funding, capacity building funding for people that have lived experience, but may not have had as much technical experience for the back office operations?
Yeah, that's a really good question. And I think that's something that Kathleen and I have been hearing and trying to dive in about what that might look like in supporting. And what's great about the MOA, it's specific, and yet it's somewhat broad. So when we're talking about recovery support services, it really just states fund programs offering recovery housing support to people in treatment or recovery. So it doesn't say just this, I think that if that program is doing some really great work, and maybe, as you said, they're going to be able to make a bigger impact if they have some of that administrative support to maintain it. From my reading, that could be part of that, right? It's supporting that service and expanding maybe that opportunity. Because I think, as you're saying, it's people who are, grassroots, in the weeds, really working. And frequently the people that are leading the organization is also doing the work. And that can be really hard to sustain. And how do you have someone who sits back to crunch the numbers, report the numbers, while also responding to the needs of the community? So I think that's just an important reminder that while we look at what are those programs that we're building in that administrative support. So if we provide like an RFP to look at evidence-based addiction treatment, who's willing and able to provide this, and we can provide support to make sure that that's included, that administrative support. So thank you.
I have an additional question
Great.
that I thought of while Jay was talking. And forgive my ignorance on this topic. It's not my area of expertise.
Yeah,
but we
please do.
certainly see a lot of overlap in the domestic violence realm.
Yeah.
I'm curious, I saw a little bit about prevention, but obviously a lot of these programs focus on recovery, and that's understandable. I'm curious what prevention might look like, and if you could speak to that just a little bit.
Yeah, and well, and it's interesting, there's, you know, the word prevention, and then there's also early intervention. And I think with the MOA for option A, it really doesn't speak a lot about prevention. One of my thoughts, though, is to help prevent future potential users is to make sure our young people are supported by their family, their community. And so some of that is helping our parents, right, get into recovery so they can reduce that impact on our children. So I feel like that's going to be kind of work happening. But what is that prevention? So what I'm excited about is because Buncombe County has really already invested in a lot of these programs through the Behavioral Health Justice Collaborative, and are, you know, doing a really collaborative strategic planning, it'll open us up to look at additional strategies that are not listed right here. This is kind of a, hey, cities and counties, you can do this really quickly and just do one strategic planning process, and that's it. And so that's going to open us up. If anyone looks at the MOA, again, that can be found on that ncopioidsettlement.org website, talk about option B. And based on what our community is saying, I think Buncombe County is getting set up to say, we're going to need to look at option B, where we're really cultivating what's specific in our community. Because when we talk about prevention, what are the needs of our community that is leading someone to misuse, to then become addicted to this substance, and be able to get really creative. So there's, I think prevention is another side, but early intervention, you know, is looking at helping people. And I think for our young people and children and families is kind of my expertise, where my background is helping children feel connected. And again, this is also with adults. Are we providing opportunities for connection? Are we looking at making sure if young people are getting that support when they're starting to feel stressed? We know with the pandemic, our young people have been really struggling. There's been that increase in suicidal ideations and attempts, and a lot of that's related to not feeling connected, feeling stressed, not knowing how to handle that. And so some of that early intervention will be looking at supporting our young people to recognize how to deal with stress and support, helping our teachers. I mean, that's going to be a big piece in our parents, and how do you deal with your stress so you can be there for your young people, so that they are able to feel better about themselves and engage in more pro-social activities. There's been a recent conversation with our Trinity House closing recently, which was for young people, runaways, homeless, or those that just needed respite from their families, and looking at what are other ways that we can provide outlets for young people that they can get engaged in positive activities. I'm excited about what Healthy Transitions is doing, and even providing scholarships for music lessons, right? Seems so small, but for our young people, when they get excited about something, you know, I remember hearing a young person who was using substances but likes making music. How can we cultivate that interest so that young person is going to be so busy doing their passion, their art, that they're not using substances? So I think that's going to be, again, something that we want to wrap into some of this work now, but also in that really long term that I hope we can really invest more in that prevention and early intervention, because hopefully we're seeing that reduction with some of the supports that we're giving to those that are currently using and working their recovery, that we're working on preventing more. I hope that answers and gives some hopefully excitement about what's possible.
Thanks. That was so thorough. Appreciate it.
And Julia, if you have any other ideas on how we can, create strategies or options from a prevention standpoint, please share. It's interesting you asked that question. Victoria and I just talked about this at our last one-on-one, how we can make sure that the prevention side of it is included in the plan that we bring forward to the Board of Commissioners. So thank you for asking.
Thanks, Deepa. Yeah, it gives me a lot to think about. Prevention's certainly hard in a lot of these areas. It's a tough ask, and so, but an important one.
Yeah.
And I think even as you mentioned DV, as how can we end up, when we have someone presenting experiencing domestic violence, we know it affects the children. Frequently there's substance use involved. So, when we're treating with the adult, what can we be doing at the same time for the young people? So Julia, please reach out. Would love to have, even if it's a sit down brainstorming, let's just talk about things, because I think sometimes it's talking through things out that we end up like, oh, and this is how it connects. I'm happy to set up something up.
Great. I look forward to it.
Regina.
Thanks.
Great.
Gina?
Regina.
Yes, I was just wondering if there have been any, when you looked at this, about getting to some of the outlying areas, some of the rural areas within the county. I know that it seems most of the stuff is centered in the Asheville area, and you've got some areas that don't even have a bus line or any way to even get to town. If any of this has been looked at or even tied into some of the mental health issues. I mean, we see a lot of people on probation that have a lot of mental health issues, and then they use substances to try to address their mental health, which is double-edged sword. One leads to the other. So I was just, as actually a two-part question, if you have any insight on that yet.
I not specifically, but I'm glad you brought that up. As a reminder, one of our comments from the this public input page was looking at how are we addressing the rurals? Are there buses? And I am excited as part of this role, getting connected with people, is looking at what some of our FQHCs, such as Appalachian Mountain, getting a mobile clinic going, even the health department, and what are opportunities to use some of these strategies that different providers are doing, and how do we partner with maybe harm reduction, letting people know what's available, and getting out into the community to meet that. So I think that is very important, because some people, right, they're coming into Buncombe County, and I was talking with someone, and we were talking about just regional efforts, right? If Madison County doesn't have services and support, people are going to come to Buncombe County to access those services. So again, how do we look at that regional level that does maybe touch into those more rural areas, to help? How can we collaborate and make services accessible, so people can be in their home community and perhaps not come into the county because they want to reach, get services, but now they don't have anywhere to live and they don't have a way to get back to their home community. So that's I think another area of how do we tackle that, and what are those resources that we have to reach those rural areas.
I wasn't even talking other counties. I mean, we've got a lot of rural areas here. I mean, if you look at Barnardville, it's way out there. You look at Leicester, it's way out there on parts of it. I mean, those people just seem almost forgotten.
Yeah. But then, like, would Marshall be closer for some of those people? And are there certain, again, that, like, what are we looking at the capacity with even just the region to reach some of those further out? Because I remember, being out one way when it was like, well, it was almost closer to go through Marshall to get down to that one house in Buncombe County.
And if you don't mind me hopping in, Victoria, Regina, to your point about the intersection of mental health care in general and looking at the opioid epidemic in this crisis, the MOA is written in such a way that there is specific language encouraging the use of these strategies to absolutely address folks who are using opioids, provide services and supports, but to apply these services at the intersection and the co-occurring nature of mental health conditions, opioid use, but substance use in general as well. So there is a lot of opportunity in the way this settlement has been written, and it's in no way sufficient for everything you just addressed, but the one sort of how are we getting outside of Asheville City proper to other parts of Buncombe today, or as these strategies are written, that I can say is that post-overdose response team is a mobile program. It's folks who operate with our community paramedic under what you think of as like traditional EMS, not one for one, but you know, they're not sitting in an office, right? They're in a truck that moves. And so much room for growth, just echoing everything Victoria said. But I do know that's one area that as we've reached out to those stakeholder groups who heard Victoria speak about, there's a lot of support and interest in expanding the role of that. But again, none of that is to contradict the need for broadening and making sure those folks don't feel unseen in this work, as you mentioned.
It's a lot with the individuals on probation. They can't get to the treatment class. They can't get there. And I mean, I've worked this job 32 years. So I just say that's a huge, huge need with the people that are don't have access to a bus line to get here. Thank you.
All right, thank you. Very good discussion. More to come. And I think what was real clear for me in mapping out like how much we'll get each year is that this felt like a whole lot of money when we first got the announcement, but it's not a lot of money, right? And so especially not aligned to all the things that we need to do in this area. So we need to be real intentional about how we use it. But the whole purpose of the Behavioral Health Justice Collaborative that we would have started even absent this opioid settlement is for us to coordinate and collaborate better so that we can come up with strategies to help solve for these issues here in Buncombe, across Buncombe County. And so when this money is gone, we need to be still thinking about and talking about how we can sustain the work that we're doing, and we can evaluate it and make sure where this funding is going can be utilized to get us the outcomes that we want to see in our community. So thank you so much, Victoria and Kathleen. They've been so awesome. Appreciate you. I'm glad y'all are on board with us here.
Thank you.
All right, so Ed and Meredith will give us an update on the driver's license restoration program.
So we started in December of 2020, I believe was the first motion in order that I presented to Judge Hill. I did a mass motion and orders for, I believe the total number was 834 folks that we had fines and fees stricken on old minor traffic matters. And so those were granted, and then the clerk's office struck those, and that got sent to DMV. We're also having a number of people are filing what's called an AOC CR 415 form, where they can request that the court relieve fines and fees. So we're seeing a number of folks bringing those in to our office. So I'm getting those before the court to be addressed. And we have handled a number of those so far this year already.
What is the AOC?
It's a form called, it's AOC CR 415. You can find that on nccourts.gov on their form search. That's a form where individuals, either, individuals can file it or attorneys can file it to request relief from fines or fees. They can either do that at the outset on new cases or on older cases. Most of the folks we've seen them come in on are older cases that are finished. Maybe their probation got revoked, but there's still some monies remaining on those cases. So they were asking the court to strike those fees so that they can work on getting their driver's license back.
Okay. Is this the same as an ability to pay hearing?
That's that would be done more at the outset when the court is considering
Okay.
what to assess in their initial judgment.
Okay, so this document, this filing happens after a fee has been assessed and you have one and you're seeking relief from it. Is that correct?
Let me pull it up so I can read off of it. So I think they've just updated the form in March. I believe it can either be done on the front end when a case is pled or later on after it's done.
Okay.
But
All right.
primarily the ones that we're seeing are done after the case is over.
All right, thank you. We recently had a visit from and actually the community engagement team was really instrumental and actually hosted this, but we had a visit from the Second Chance Alliance. And they're opening a chapter here. And some of the information, some of the movement that they're working on right now is ability to pay hearings, and actually asking if people can do those before fines and fees are attached. So this looks like a really good document for relief from that. I'm really interested to see what Buncombe County Justice Services could or would do on the front end to prevent the fines and fees from happening in the first place because of a person's lack of ability to pay.
Did
Jay,
Judge Stolberg?
This is Ed from Pisco Legal Services. I'd just like to say I was at that chapter launch a few weeks ago, and there were some great conversations had on that subject. And it was great to.
It was at a great coffee shop.
It was. The iced coffee was not bad. And there is a movement statewide and nationwide as well to have a real conversation about fines and fees. I think people are starting to realize that there's a strong racial equity component to this. There's a criminalization of poverty here. And so many of the issues that you are talking about in this meeting, they depend on access to reliable transportation. All these wonderful services that we're talking about making available, if people cannot access them, it's basically meaningless. And as I think, as Regina Ray indicated, you might get by in Asheville on public transportation, but for a rural area, that is not an option. And again, even just Buncombe, I serve personally 11 counties in West North Carolina, where I have clients in a place like Mitchell County who are somehow surviving, with a moped where they have to ride 30 miles to get groceries because they haven't had a driver's license in 20 years and they don't know why. I could go on and on about this. I'm not going to. I want to respect everyone's time. I will just say that we have some real opportunities here in Buncombe with the DA's office and the courts and some of the nonprofits that are working on this issue. It's a great start. And Todd Williams' office has done some amazing things to forgive a lot of old fines and fees, as Meredith talked about. And seeing people use the 415 form is a fantastic step. But the demand for this is absolutely enormous. There's never going to be enough free lawyers in the world to deal with everybody in North Carolina who has suspended driver's license. By some estimates, it's 1 in 7 adults, which is incredible if you think about it. It's also, as great as it is to have Buncombe County on board with this, I don't think I've ever had a single client who had a suspension in just one county. And each one of those suspensions has to be dealt with county by county. So we're very fortunate to have the DA's office that we have here. It's almost too easy to resolve Buncombe issues, but then I have to go to Henderson for that other speeding ticket. Then I have to go to Rutherford. Sometimes it's a South Carolina issue. It's a Florida issue. So there is no easy answer to this, but I think just raising awareness of this issue and getting people to think about how, if we want Buncombe County to be a more equitable, fair, safer place for everyone to live, this is a great high impact way to start. I also do expunction work at Pisgah, and we're getting some great results there. The legislature has really expanded the relief that's available there for folks. We're getting some folks real clean slates, but a lot of people are just still not going to be eligible for various reasons, or they might not be eligible yet. But many of them also have suspended driver's licenses, and that is something that we can make an impact in the short term. I think in this job market in Asheville, you can probably get a job with a criminal record. Maybe not an amazing job, but you can work. But you're not going to keep that job without reliable transportation. So it's just such a huge knock-on effect that it's going to have on housing, access to services, nutrition, education, all those things. And we now have a small fund, thanks to the Safety Justice Challenge, where we're able to assist residents with paying old fines and fees. That's the best way to deal with some of this, but that's certainly not the only way we need to deal with it. And there are things happening around the state where different jurisdictions are beginning to address this, long overdue. Again, I want to respect everybody's time. I will put my email address in the chat. If anybody wants to talk about this issue further, I certainly can do so. And I hope that it's something that you're interested in hearing more about at some point in the future. Thank you for having me.
I just wanted to mention one more thing. We get people calling our office all the time who've missed court with the failures to appear. We're always willing to ask the court to strike those. I can't tell you how many people called this week that I presented to the court to strike those. failures to appear, get them a new court date so that we can reduce their tickets and take care of those traffic matters, and so they can be able to get their license back.
I'll just say one more thing. I wish, I tell Meredith this all the time. I wish that all the district attorney's offices around the region were like hers. It is much harder to get these issues resolved, even 1 or 2 counties over. And as I said, it's very rare to get a client who has just issues in one county. And with the limited resources that we have, my ability to negotiate all those different systems, it's limited. And every county, their clerk's office and their judge and their DA's office, they all do it differently. So there's not even one way to fix these problems across all these counties. But the support that Meredith and her team provide is absolutely amazing. And they're spoiling me for all the other offices that I deal with. So thank you again, Meredith.
Thanks, Ed. I appreciate it.
I've got a question about this. Several years ago, I was in a bipartisan group out of Duke's Sanford School of Public Policy, exploring how to reduce poverty in North Carolina. And one of the things I looked at was the issue around driver's license revocation and just the basic access to jobs. I mean, and I think they told us at that time, the number was something like 900,000 people in North Carolina have a suspended or revoked driver's license. It was like some astronomical number that is definitely impacting our economy too. I mean, in terms of just like, if you're a business owner and you want to hire somebody, they need to be able to get to their job. And so there was an acknowledgement that this is a huge challenge for all kinds of reasons. But is there any state or way, anybody who's looked at a comprehensive approach to address this problem? I mean, is there like state legislation we should be requesting? It just seems bizarre that it is absolutely so difficult to restore your license and you have to navigate this crazy system just to do it. But I don't know, does anyone know if that's been looked at?
So I believe there was legislation pending last year that did not make it all the way regarding limiting the terms of suspensions. As it is now, a failure to pay or a failure to appear, it's an indefinite suspension. Could be the first time, the only time, it's forever until you resolve it. There was something, I don't know quite how far it got to sort of make that a fixed term. And there are some workarounds for that, besides the 415 form that we've talked about. There are limited driving privileges available in some instances, but it's so rare that I even get a client come to me who's actually able to tell me why their license is suspended. Other than that, it is in fact suspended. And the ones that think they know often are wrong because it is so confusing. It is very hard to get someone on the phone at DMV. I believe Asheville DMV is now booking appointments for July. So you can imagine for somebody who's really in a crisis and really needs to restore that license, that's not good enough. There are solutions that are being done sort of piecemeal around the state in various jurisdictions. The mass forgiveness has happened in a few other counties. I know of Mecklenburg, Wake, a few others, Forsyth. Chapel Hill has an amazing program where residents of the county can apply to the county for relief of some of these fees. It's just a line item in the town budget. And amazingly enough, it's administered by the Chapel Hill Police Department Crisis Unit, where social workers and uniformed police officers work on this and help people get their licenses back. So there isn't, as far as I know, sort of an overarching solution, but there are people trying some interesting things.
When you say the mass forgiveness, is that whose discretion is that to do the mass forgiveness?
So that's like what Meredith was describing earlier. Okay. with the DA doing those mass motions. And again, and that is tremendous. And I would love to see that happen in the rest of the region. It is tremendous. And I know it's a lot of work for Meredith and her staff as well.
To orchestrate the mass forgiveness is a lot of work because you got to, okay. Because I just, we get all the arrests by Asheville Police Department and all the charges for individual. We don't get all of them. I'm sorry. We get the ones where there's guns seized or drugs seized or whatever. But always, I was just looking at today, you see driving with license revoked on there, and it just seems like it compounds it, right? Yes. So somebody's now they're because it, yes. I mean, I've been in court watching judges yell at people for that, but Anyway, yeah, that's a really frustrating problem for the community.
And I'm sure anybody that works in reentry can speak to it too. When you're getting people on that end of it, how can we expect people to succeed without reliable transportation? I think DMV used to be able to send caseworkers into correctional facilities to at least help folks renew a license, not restore one that was suspended. That had to stop because of the pandemic. That's understandable. But I think even at best, they were not working on suspensions. And that is a very common thing that we see with returning citizens who are going to tell you, I've never had a driver's license, or it's been 20 years. To me, sending that guy home and expecting him to make appointments and meet his obligations, that's like you're graduating someone from high school and they can't read. And yes, I know we do that, unfortunately. But there is so much here that this touches on. I don't have a formal kind of referral process with the treatment courts in Buncombe, but they find me anyway. You know, I know Kevin from the Veterans Treatment Court, and it feels like all of his guys have suspended driver's licenses, and they find me piecemeal. I don't even do any outreach because I already have way too many cases, as you can imagine. But the demand for this is just absolutely astronomical. And if you're talking about getting somebody back on their feet, it's a really high impact thing that you can do and prevent them from having further contacts with law enforcement. Because the sad reality is that many people, they're going to drive. You can tell them don't, you can send them to jail for it even, but they're going to tell you, I have to go to work. I have to go to the pharmacy to get my medication, whatever it is. And the problem does not just go away.
Ed, I was going to ask a few questions, and maybe we could, Chair, invite fiscal legal back, because it seems like a very important issue. And maybe some follow-up questions I have in that is like, how many are you currently serving? How many are like on your list or to be served that you can't reach? What are some ways that the city and county can raise awareness about the services? I even like the mass relief. How do we communicate with those who had the relief available? And just like, what would it take for something like Buncombe County to do like a clinic such as Chapel Hill or Durham? Durham has a restorative driver's license restoration clinic, and not just one part-time, a person doing it part-time. So those are just some follow-up questions I had, and I don't know if we have time to explore those right now, but I think will elevate this issue a little bit more.
Those are great questions, and I probably would take way more time than you want to answer all of them, but I'm certainly happy to come back and put together some numbers. I will say it's a little bit difficult to give you a precise number on the number of clients that I'm serving specifically for this, because so many of the driver's license clients start as expunction clients, and they don't know that we even offer the driver's license restoration service. But in running their criminal histories to see what expunction relief is available, I notice, oh, you keep getting arrested for driving with a suspended driver's license. Can I help you with that? I have close to 200 cases in general. That's probably a pretty even mix of expunction and driver's license restoration, and a lot of them are both. And again, we do a very limited amount of outreach just because the capacity is there. I'm covering, like I said, 11 counties, and there are some counties, unfortunately, I know this is Buncombe, but there are some counties where I think I've maybe gotten 1 or 2 clients in a year and a half. And I know that's not because the demand isn't there. It's because they don't even know we're doing. So I'm happy to come back and address specifics. And I really appreciate the support.
Tiffany, I did just want to let you know, the folks who got the mass relief, you can go to ncfairchance.org. There's a button to check for restore your driver's license, and then you can put your name in and date of birth, and it'll pull up if you've gotten relief through the mass motion and order.
If I could make a comment, a few years ago, Mayor Mannheimer, the legislature did change the laws regarding driving while license revoked. Meredith, you may be able to help me out a little bit on this, but they divided them up between non-impaired revocations and impaired revocations, because there's not a lot of help we're going to get in reducing an impaired revocation. In other words, if somebody's had a prior DWI, that's treated much differently by the system, because those revocations are much firmer and harder in terms of public policy. And so by dividing it into a non-impaired revocation, they've reduced the penalty on that, And it also creates, you know, a kind of a little milestone or a little tickler in the system to where you can see that that's what this is. And so then it's a tip off to know very quickly what kind of revocation you're dealing with. And so that's been helpful. And I would like to think that all my colleagues in the public defender's office and in the bar here not only are representing folks when they get a charge involving a non-impaired revocation, they're not only handling the non-impaired revocation, but they're handling what's making the non-impaired revocation. One of the difficulties, of course, is these revocations can come from all over the state, as Ed mentioned. And so it's very hard to coordinate activity on old cases in other counties and other jurisdictions. But we do try to do that. And of course, within the network of public defenders offices, it's a little bit easier to do because we have emails, you know, we have colleagues in other offices that we can simply email and, you know, they can probably drag something in and handle it or get it dismissed so we can handle something else. So we have a network of folks around the state that help us do that. But what Ed's talking about are folks that right now may not have anything pending, but are seeking relief, you know, because they're looking for a job or they realize that they have an opportunity for a job and they'd like to get their record as clean as possible. And as far as this 415, I've done two myself. One of the hitches to filling out an AOC CR 415 is that it requires a notary. But we have a workflow in our office that we have a notary in our office and we're handling all comers as they come in our office. So this is something we've been working on for 20 years. It's become a little bit easier. Honestly, we've got a lot of buy-in is from Meredith and the folks in the DA's office. We have a great deal of buy-in from them, and that's what it requires, right? Everybody has to have buy-in, the DAs, the judges, and the defense attorneys, and the clerks, everybody.
After, outside of what justice services are able to do, and I actually was present with one of our clients with Jordan Peer Recovery when he went to a hearing at the DMV. After all fines and fees are covered and after you deal with the criminal justice aspect of it, then there's still
I think we lost Jay. You're breaking up, Jay.
If Ed were able to come back. Oh, so I'd be very, can you all hear me better now?
Yes.
Yeah.
I may have is that better? Is that better?
Yes.
Sometimes it's better when the video is off. Anyway, the DMV is a whole nother aspect of this that
That's
even
correct.
after the courts are taken care of, the DMV seems to be a no man's land. I was actually in a hearing with one of our clients in the nonprofit, and he was suspended for 10 years and had one known infraction in those 10 years, and they denied him after everything. And he was working, had been promoted, been working consistently for a year and a half and everything. So we still provide transportation for him because though he can afford to drive and know he's paid everything, the DMV did not approve. So anyway, what I'm saying is I'd be really interested for Ed and them to come back and us to have that as a full agenda item so we can understand it, and especially to see some of those gaps, because it could be some stuff outside of justice services.
Yeah. Thank you all. Very, very good discussion. This is not something that, you know, is isolated to North Carolina. I haven't been in a state where this has not been an issue. And the laws are different, statutes are different, there are different ways to come at it. But we should probably, I mean, not even just in a JRAC meeting, have a work group or something, get together outside of this meeting to talk about ways that we can all collaborate to figure out, you know, what's the best solution here. The other piece is the state, DMV, right? And so I don't know, I'm sure y'all got partners we can bring into the conversation as well. Good conversation, maybe some offline conversations before we bring it back to the full body to have more discussions on this. This has been a great, great meeting. So Tiffany, you got 2 seconds. No, you got a couple of seconds here.
I will take about 15 and I'm gonna just roll mine into announcements and departmental updates.
That works.
All right, so myself, DK, Natalie, pretrial release program manager, and myself went to Charleston. It was the first time the National Network of Criminal Justice Coordinating Councils convened. We spent much of the time in Charleston looking at standards. There's about 50 kind of best practices. As you know, these coordinating councils aren't in most communities. And so wanting to set standards for what it looks like as communities continue to want to learn how to collaborate and be more effective together and not work in silos. So what we are great at the foundational work and have done a lot of the standards that they're setting. I think we have the foundation where we can be digging in a little bit deeper. One thing I found helpful is Charleston has really figured out how to integrate their community engagement efforts so that the community engagement group and the JRAC are working simultaneously together. As far as announcements and updates, and if we have any more information, I think we can present it once the standards get finalized. I'll be presenting on the work that came before you all, Spark, and my daddy taught me that in the Racial Justice Coalition, on the work they've been doing in gun violence prevention. So I'll be briefing the commissioners on that June 7th and kind of talking about next steps. And I've been invited, thank you all, from the city of Asheville to present to their public safety committee. The goal is to do this in coordination with each other and work simultaneously to help address community violence. And so I just wanted you guys to be aware, and if you're able to watch it and see it. And that's kind of our update. So thank you.
All right, thank you, Tiffany. I think Sam, you had an announcement as well.
I had an announcement. Did I?
I thought you did. Did I hear that wrong? Maybe I'm reading it wrong. You want to make up something? No, I'm just kidding. If you don't have anything.
Sam, I just put on DK's radar. Just 1 second. Sorry. The meeting that we had last week with the nonprofit, I think you wanted to give a quick update about that. And
please help me, Natalie. I know we talked about it now, but I'm pretty ADD these days, so help me out here.
I can't remember the name of the organization that we met with, that we heard from, but essentially it was a nonprofit organization that had spoken to, I think, the public defenders as a whole in the state of North Carolina. They're an entity that provides supportive services to public defenders, is my impression. And we met with them just, okay, yeah, can I pass the ball to you?
Thank you. You're right. This came up in a statewide meeting of the public defenders. They presented, this organization presented, and I don't know the name right off the top of my head, but I talked with them about an audit of services. They could come in and perhaps look at what we're doing and how we're coordinating our diversion services with our treatment courts. And they were going to get back with us about, what kind of plan, what they could offer us and what kind of service they could do and how long it would take them to do this audit and how much it would cost and who would pay for it and all that. And so it's just very beginning stages of having an outside organization that could come in and look at how we're doing the things that we're doing within the system. And I thought it was a decent idea. It was worth exploring. But as you can tell, it's in the very early processes.
All right. Thank you, Sam. Thank you, Natalie. Any more announcements?
Yes.
From JRAG members?
Can y'all hear me?
Yes.
I got permission to do this. I want to, this is going to be probably Regina Ray's last meeting as probation, for representation of probation, as she's retiring after 30 plus years of service. Did I get the number of years right?
32.
He said 32.
Congratulations.
I was thinking about that, Regina. It's like 32. Okay.
Yeah.
Yeah.
Congratulations, Regina.
Thank you. I'll still keep an eye on y'all. It's been a pleasure. I've started with the inception of this and have been almost every meeting. So I'll still keep tabs and throw my 2 cents in if occasionally.
Thank you for your service,
Thank you.
Regina. Any
I
more
have an
announcements?
Announcement.
Go ahead.
The Juneteenth of Asheville, Juneteenth event coming up on June 18th. It's really important that lots and lots of people show up for it and show the support, especially after, you know, such recent tragedies. It's important that folks feel the love and community support, and to the degree that county government can, you know, let them know that you're there.
Thank you. Do we have any public comment? Folks from the public that would like to share? Okay, haven't seen any. All right. Seeing none, before we adjourn, I'd like the body to consider if you all are ready to move back to in-person. I think all of my other meetings are now in person at this point. So I wanted to give you all the option as well. We don't have a whole lot of meeting space, so I would have to start working on that ASAP if we're gonna move back into in-person for JRAC. So just want to open that up to see if there are any thoughts or I guess any objections to trying to move into in-person for our next meeting, which I think would be, what's this, June, August? Any objections? Support? Okay. All right, so we will plan. Tiffany, were you gonna add?
I'll say we can also make hybrid available if possible.
Yeah, so if you have meetings before or after, can't make it physically, or just not comfortable quite yet coming in person, we'll do hybrid. But I think I've had that question posed to me a couple of times, so I think some of us are ready to get back together in person. I don't know if it has something to do with lunch. I'm not sure. I don't think so, but but we'll move back into in person, and we'll do hybrid for some period of time. So we'll entertain a motion to adjourn. This has been a good meeting. Good meeting.
I move to adjourn.
All right, second.
Second.
All in favor, just raise your hand or clap or something. All right.
Aye.
Opposed? None. Y'all have a great weekend and take care of yourselves. Bye-bye.
Hi, everybody.